And there she is, Dr. Dyan Hes, joining us this morning here on Indiana in the Morning. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. She is a top doctor, as so named by New York Magazine. Boy, there's a title. How'd you get that one, Dyan?
I have friends in high places.
She's the medical director of Gramercy Pediatrics in New York City, director of the American Board of Obesity Medicine, board certified in both pediatrics and obesity medicine, and practicing both in her New York office and as a clinical assistant professor of pediatrics at the Weill Medical College at Cornell University. Okay, that's all. No time for the interview now. We gave all your titles. That's amazing. Hey, Dyan, we're wondering, here comes Memorial Day. People are going to want to get together. It's been so long for so many since they've actually seen their family members, let alone sat down and had a picnic with them. But we're also wondering, can we do that and do it safely?
Yes, you absolutely can. You should be, if you're not vaccinated, the only thing I would say is if you're indoors with people who are not vaccinated, you should be wearing a mask. But if you are vaccinated, you should be able to go in and out of somebody's home freely. And if you're outdoors, I don't think a mask is necessary at all unless you are, you have some health reason that you didn't get the vaccine and you're immunocompromised. But, it depends what part of the state you're in, but in most states where the virus rates of the virus are very low, the risk of getting COVID outdoors is almost nil, let alone if you're vaccinated, it's really going to be nil. There's 5% of breakthrough COVID regardless. The vaccine doesn't prevent illness, it prevents death. But what we're really seeing, especially in the kids, is that the kids who have gotten the vaccine, they didn't get any breakthrough COVID. There was no cases at all.
Yeah, which leads to a question that is probably a pretty sensitive one for some folks. Do we ask everybody who's with us, are you vaccinated or not? Or do we maybe not allow them to come if they're not vaccinated and they don't want to wear a mask?
I think that if they're not vaccinated and you are, you're safe for, in your outdoors. It's your home. If you're inviting guests, you get to make the rules. That's the truth. But I've been reading, I'm on all these doctor blogs, and I read an article, I read a post last night that somebody's mother is getting married, and she only wants vaccinated people at her wedding, and the husband is not vaccinated, so he's uninvited. And, get the vaccine. Get the vaccine. It works. It's safe. This is the only way we're going to get back to normalcy. We need our economy open. We need our schools open. We need our small businesses thriving. We need people to be able to earn a living. And we're not going to do it unless we reach herd immunity. And that is only if everybody who's eligible can get the vaccine.
Has it surprised you that it's been so difficult to get that message across?
No, because I've been a pediatrician. So I've lived through the anti-vax movement. And, it's based in irrational fears and conspiracy theories. And anybody who's worked in kind of mental health area or arena knows that conspiracy theories are the hardest to break. And, the flavor of the month now is saying it's causing infertility, but that's what they said about the HPV vaccine. And guess what? It doesn't cause infertility. There's never been any reason to associate with fertility, but that's where people go. Fearmongers want to make people have their view, and they cause fake news that makes you click on it. And, we have to break that message, and we have to get it out that it's safe.
Our poll question this week from the Indiana Regional Medical Center at our website is a new poll indicating the majority of people who have gotten their COVID-19 vaccine would get a booster shot if deemed necessary. And so our question for our listeners and visitors to our website is, would you get a booster shot if you've already had your vaccine? 60% say yes, but 33% say no, if there's a booster shot that's needed, I'm done. I'm not going to get another one. Does that surprise you?
It doesn't surprise me because people aren't lining up to get needles, but people might also think, people are naive. Go to India and ask somebody who's not if they don't want to take a shot. So when you see people getting better because we're a first world country, it's very easy. I always say vaccine refusal is a first world disease. You don't go to a third world country and see anybody refusing a vaccine. They walk 6 miles with their child on their back to get a vaccine. So I think it's just about education and really good messaging. And I think that's where the CDC has failed us. I think the messages are so not concrete, and there's too many options. There's too many leeways and too much wiggle room. People like direction, and people like their scientists to be confident in their decision making. And I think a lot of this fear is because the CDC changes its rules every 2 days. And I'm not a scientist per se. I'm a doctor, and it's hard for me to interpret the data. So how do you have the general population do it if you're changing the rules every day?
Yeah, and if we're listening to one person or another and that message from that person keeps changing, obviously there's going to be a trust problem there, isn't there?
Yeah, and I was just talking on the other station I was on about the visual. Like, so they're saying that if you're all immunized, you can work together in a room without masks. But then you see, Joe Biden, President Biden, sitting in the Oval Office, all 6 feet apart, and all with their masks on. But they were all the first people to get the vaccines. So why are they wearing masks? I don't understand it.
Yeah. Hey, as long as I have you on the line and you are a pediatrician, there was a question came out yesterday about what is going to be different post-pandemic about some of the things that we're used to doing. And one of those was something that I'm sure you have noticed and dealt with within your office for a long time, and that's the doctor's waiting room. If you go to the doctor's and you're sitting in the waiting room and there's all kinds of sick people around you,
Sure.
There's a pretty good chance that you're going to pick something up that you don't want to have. And that's going to change now, isn't it?
Yes, but remember, you still always have your option to wear your mask. So, I still have some COVID prevention guidelines in my office. We still only allow immunized, if the parents aren't immunized, only one parent can come to lessen the burden in the waiting room. If the nanny's not immunized, she can't come into the office. Hospitals will have to make rules. And I think all of medicine, until we reach herd immunity, is going to be changed, and there's still going to be limitations on waiting rooms. The chairs might be separated because, not everybody's going to even want to tell you if they might say it's none of your business if I'm immunized. You're not my doctor, you're my kid's doctor. So, we're going to have to take it as it comes. But to be honest, right now, the number of sick kids had been really way down, and sick adults, aside from COVID. Now that the cities are opening up and towns are opening up again, we're starting to see more sick kids. And, physicians and hospitals will have to adjust. But my guess is that the risk of getting COVID in a waiting room is going to be very slim. If you're worried, put your mask on.
Yeah.
Slim to none, probably none.
And as long as I have you on the line and you're also an expert in obesity medicine, let's talk a little bit about all the extra weight we put on during the pandemic and how to safely get that weight off, because that's going to lead to even more health problems down the road.
Oh, 100%. I have patients who gained 20 to 30 pounds on a kid, on a 10-year-old, on a 7-year-old. I mean, this is much more dangerous than COVID to them because it's very hard. I'm an obesity medicine expert for kids. It is very hard for a child to lose 20 or 30 pounds. This is a child should gain about 5 pounds per inch that they grow. So let's say they grew a half an inch or an inch during COVID, and instead of gaining 5 pounds, they gained 20 or 30. How long is that going to take to get off? It's going to take a lifetime. And we know that if you're an obese adolescent, 85% chance that you're going to be an obese adult. It's very, very rare that there's a small 15% chance that you might lose that weight, which is going to cause pre-diabetes, diabetes, stroke, heart attack, any kind of cardiovascular disease, arthritis, joint pain, the myriad of problems. We need our kids outdoors at playgrounds, running, playing. I mean, I've said it since the beginning of the pandemic. Closing playgrounds was literally the dumbest thing I've ever heard. Closing sports arenas, those big ones where you have high ceilings and kids could run freely, and adults. Closing parks where people can walk. I mean, they only cause more harm. Yeah. 75% of the kids who passed away from COVID, and there's only 296 of them, were morbidly obese. COVID likes fat. It will find you and kill you.
She is Dr. Dyan Hes joining us here this morning. What are some resources that we can use as real go-to resources we know we can trust so we can learn more about obesity and safely losing the weight, especially when it involves kids, and about gathering together for after the pandemic?
The American Heart Association, the USDA, they both have really great resources. They have meal plans and portion guides. Healthy People from the government, healthypeople.org, I think it's called, has very good guidelines. And then the American Heart Association, the ADA, if you're diabetic and also pre-diabetic, they have great menus, great options, lifestyles. For children, I love healthychildren.org. It's the American Academy of Pediatrics website. They have meal plans starting 8 months and up, portions, and how much activity your child should have. There's no lack of finding good information. It's about motivating yourself to get out of your chair and go do it. That's the hardest part. She
has so many titles and awards. Her desk is really, really big. She is Dr. Dyan Hes joining us this morning. Thank you so much.
Thank you.
Have a wonderful day. Bye now.
Bye-bye.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.